right. Good morning. Top of the morning to you all. It be St. Patrick's Day weekend. I'm wearing my green. I hope you're wearing your green. And we are very lucky today to have first a big announcement. Mr. Mitch Hilby himself. Mitch Hilby is going to help me co-host the live event today. Let us all know how you feel about that. I'd love to hear it. And importantly, we are going to be talking about the most listened to podcast on CRPN Central, the one that everyone wants to talk about, negotiations. Before we start, welcome to CRPN Central, the podcast dedicated to bringing you the best minds in the industry so we can talk about the problems, discuss them, and figure out solutions for everyone, something that can work for everyone. Like, comment, subscribe. I have 34 subscribers now, Mitch. 34.
We're getting there.
We'll see. Little by little, everyone's going to love it. All right. So coming to the stage here, first, we're going to have Mr. Alan Abraham and Miss Viljena Trask, the two superstars of today. Before we start, I want to make sure everyone's happy. Viljena, did you have something you wanted to say?
Yeah. Hi, Dr. Fox. So I just wanted to mention that the views and opinions are my own and do not represent the views and opinions of my former, current, or future employers.
All right. Thank you very much, Viljena. Viljena, any lawyer will be very happy to hear that, and we highly respect your experience and what you have to say. Mr. Alan Abraham, would you be willing to introduce yourself real quick?
Absolutely. Thanks for inviting me today. So I have been in healthcare for 30 plus years. A lot of that has been taking care of patients at Children's Hospital of Pittsburgh, working in the cardiovascular space. I learned early on the value of clinical research and trials while I was taking care of patients. And so the last 20 years, I've been started out as a coordinator and have worked as a manager, director, and most recently work with preferred primary care physicians. It's about 20 sites in Western Pennsylvania, and also the University of Pittsburgh, affiliated with the medical center here. And so get sort of wildly different outpatient and inpatient areas, and a lot of it involves the negotiation of budgets and contracts for both groups.
I could only imagine the diversity that you have with the university systems and a private center.
Yeah, totally different.
Oh my gosh. I mean, you go from everything from your standard 96-week, 2-year contract all the way into the crazy, maybe investigator-initiated trials where you have to work with local IRBs through the university. Right. Woo, Alan, that's
keeps me busy,
lot, man. Viljena, would you be willing to introduce yourself to the audience?
Yes. Hi, everybody. I'm Viljena, and I have been in the industry, clinical research, I guess, for 14 plus years now. I started on the CRO side, and I just recently ventured into an opportunity for the lifetime to be part of Daiichi Sankyo, which is a very, very important therapeutic area to me as a cancer survivor. So I am here to support all the patients out there who have unmet healthcare needs. But my background is just like Alan's, in site contract and budget negotiations, site relationships, and the primary therapeutic area that I work in for the last few years has been oncology.
Wow. Well, and first and foremost, Viljena, congratulations. Very well deserved. And your previous employer likely misses you a lot, is my guess. Because I know that I miss you at your previous employer. I can say that.
Yeah, I still get to talk to them.
So today we're going to talk about, like I said, the most listened to podcast in CRPN Central history. I've been doing this for over a year now. We've gotten good topics, but everyone loves to talk about negotiations. And Mitch, right before the recording started, you said something very interesting about this episode, and I was wondering if you'd be willing to share your insight on how you saw, like,
Absolutely.
what you thought.
I mean, I think my perspective of why it's probably the most listened to episode by substantially, right? Was it really just because everyone's curious about this topic? Everyone wanted to hear from Alan and Viljena separately. Well, what can I do to maybe improve negotiation tactics at my site? How can we look at how we're budgeting and how we're building, our costs? And what can we actually work into our budget negotiations moving forward?
Mm-hmm. Now, I'm going to ask both of you. We'll start with Viljena. You got to listen to the podcast. When you listened to your interview versus Alan's interview, how did you feel about it?
Sites perspectives are always different from the CRO pharma perspective. And I was like, one takeaway from Alan's conversation with you was that there are sites who get it, who get how this whole big machine works. And I think you made a joke about that if me and Alan were on opposite sides of this, we would get it knocked out in like 2 days. And that's the signature process. So, there's hope. And I think we can do through events like this, we can do more education. And, I'm very lucky to attend conferences where I can connect with more sites and help them out, because we want to help the sites that are having, difficulties with those one and done studies or the investigators. And it all comes down a lot of times to the finances.
And Alan, what about you? When you got to listen to the podcast, what'd you think?
I wasn't that surprised because generally speaking, if you have seasoned people that have been doing this, you know what to ask for, you know how to ask for it. Yeah. And ultimately, and if we don't push out anything else today, the main thing is that these clinical trials are the very beginning of the healthcare cycle, right? This is what enables us to do better every few years, to have better treatments, better options. And so I really wasn't that surprised that Viljena, who had been doing this over a decade, sort of viewed things like I did. I think when you have a mismatch of someone that may be seasoned, someone that's not, it's more difficult to sort of talk the talk and know exactly how to, for instance, if you're not going to win every line item, that's not, that doesn't happen in real life, right? You don't get everything your way. So you have to sort of compromise and know like what you can compromise on and what you can't. And so I guess I was pleasantly surprised, but by not that much, because I frankly was like, yeah, that makes sense. She gets it. And so I was glad, that to sort of reaffirmed my thought process that people that have been doing this a while and are compassionate pretty much align.
It's almost like experience heals all negotiations, right?
I mean, you can't take it personally. There's so many things involved. And after you do it for so long, you can't take things personally. We have a job to do. We want to get these trials open, and I certainly don't want to be the weak link and hold up any trial.
Yeah, it came up earlier too. Is you catch more bees with honey than you do with vinegar, and acting in good faith, negotiating in good faith is pivotal in that process. I've heard historically the phrase, the best negotiations are ones where both parties feel like they got screwed. Maybe we could spin it and make it where both parties feel like, they won and they were successful and it was a good negotiation. But
I think the minute inherently, it's like we're on opposite sides, right, of the fence. So therefore we must be enemies. The minute you look at someone you're negotiating with as the opposition, definitely not the way to look at it. We both have the same goal, right? We want to get this contract completed, signed, executed, and move it on to the patients. Now, there are many ways to do that, but in general, you got to make friends with people. You got to be cordial enough and professional enough to sort of banter back and forth that what you can and cannot agree to. And I never look at anybody as sort of like, well, that's the competition, that's my enemy. It's like, okay, they threw us together. We have a job to do. Okay, we're smart enough to figure this out. Let's figure it out.
I have to tell you a story that just happened to me this week. But we were doing a negotiation, right? We're going back and forth, and we're about the third part. We're ready for that phone call. We both talked. We're okay. Alan, they actually took a phone call with me. I was so surprised. So let's do this phone call. So I was driving when I got the notice to do a phone call. And I was like, I'm not going to do this while I'm driving. So I stopped. I stopped at the side of the road to take the phone call. I got on the Teams meeting and I'm sitting here. And I looked over to where I parked next to. And I'm in front of a Christian church. Oh my gosh, I am negotiating in front of a Christian church right now. So then I was talking to her. I look at this. I'm in front of a church. I'm an honest guy here. Come on here. So that right there, just the fact that we kind of had a little banter, had a little funny thing about it, but at the same time, we were very serious. We showed that we were human beings and we're here to help each other. Negotiation went. Once you establish the fact that you're both working toward the same goal, you become more synergistic in what you're doing and you can help each other.
Yeah, in some sense, you become like a team, right? So like you're thrown together. So now you got this thing this task in front of you. Okay, well, let's make the best of it. You know, you're not always going to agree on every single line item, so you have to know that up front, and you can't take any of that stuff personal.
Viljena, that was your big thing too,
ahead,
right?
Mitch.
Was hopping on the phone. I know that was one of the big takeaways that I had from yours was you love getting on the phone. You're like, we can knock this out in a couple minutes.
I've been on the phone all day today and yesterday, just trying to make things happen. Because like you call somebody, you get to talk to them, you make a connection. You know, this is what I talked about at SOS as well. The best site relationships, negotiations. You know, when you really need to get something done very quickly, just pick up the phone, talk to the person. I'm closely watching my phone right now because there's a critical site activation going on. And,
boy.
you know, I wish somebody picked up a phone a month ago, you know, to get this ironed out. And now it's escalated to sponsor level. And it's like, we want to keep the site happy because we really need the site because the site has the patients who really need the treatment. And that really gets me going.
Yep. And so if Viljena ends up disappearing halfway through the podcast, we know why. It's because she's
maybe she'll let us listen in.
Yeah. Get it done. Get it done, Viljena. This is how you get things done. So you said you were on the phone the whole time, like past few days. Have you gotten things done?
I wouldn't say the whole time. You know, I was trying to reach the site. I was trying to reach the CRO, and you know, a lot of communication happened through email, and they finally agreed to our invitation to have a phone call. And then on the phone call, we had to knock some sense into the site's head, the negotiator who was really holding things up. And that was very, very frustrating. And, you know, as a sponsor, we want that site. We need that site because we want the patients to have access to the new medication because they really need it for that patient population.
Was that $20,000 open the door fee you talked about?
Open the door fee.
Yeah, and it wasn't the open the door fee. It was just some very interesting items in the payment terms that I had never seen before. And once in a while, I'll, you know, text Dr. Fox. I'm like, what is this nonsense? He's like, yes, that's nonsense. And it turned out to be sense. And you can't tell somebody who's been in the industry very little time, who's fighting tooth and nail because they want to prove themselves as, you know, a good employee, a good steward of companies' resources and things like that. Like, no, this is not how it works. And, you know, to your point, Alan, once you get people who in the same room who have enough experience to understand how everything works, it's so much easier. So much easier. You don't start fighting over, you know, nitpicking this and that. And, you know, a lot of times I know when I receive a contract and it's a new JD who just got their degree and they just cannot wait to review that contract, and they review it out of context. Like this is the things that you're asking, the things that you're revising, they're not going to make or break, you know, the whole process, how things work in clinical research. Like what you're asking is never going to happen. But you know, that's
a fresh inexperienced attorney just looking at a CTA for the first time is going to redline things that are normally just industry. This is what we do.
Right.
Yeah,
and there's no way an entire industry is going to fold to a single lawyer. That's just not going to happen.
Oh, yeah.
One thing that struck me across the conversations, and this is a big difference, but at the same time similarity, is Viljena, you said that you sat there waiting on sites for weeks on end for sites to respond to you. And then Alan, you said, I want to make sure I get this stuff together. I want to get it to them within 48 hours notice. So I thought to myself, oh my gosh, so we've got two totally different sides of the spectrum, and they're both waiting on the other side, depending on who they're working with. So what do you think about that difference in between, like from what Alan said as a site versus what you experienced as the other side?
I think one of the...
I think internal processes, Alan. Internal processes in resource availability is like, if you have the resources and you have the internal processes, because you have the experience, of course, you'll have like the internal processes. things go very quickly. But then on the other spectrum, there are internal processes like with academic institutions, especially in oncology. It's like, does this academic institution want to work on this clinical trial? So they have to go through that feasibility internally, because oncology is so competitive. And then we wait, and nobody tells us why, and nobody can pick up the phone and like sort things out. Sites are not communicating enough information for us to understand what's going on. And then 6 months pass, and then they're like, "Oh, we're ready. Now we're ready."
Yeah,
And then,
that's my struggle on the university side, is waiting, and I'm internal, right? So I can get the budget negotiated rather quickly, but then it's the contract piece that we're looking through, in the Medicare piece, and that's definitely one of the big differences on the university side. It may take 6 months to get something
Easy.
complete, because you have too many people. It's too large of a bureaucracy. Whereas the outpatient setting with the private practices, everything runs through me, so it's much more streamlined, and we can accomplish, get that out in a few weeks at the most, a contract. And I think that the difference of me getting back to the sponsor or the CRO, there's so many people that work in this space that I think you're gonna sort of have experiences all over the place, from Vilena's, where they're waiting for the sites, and on my end, where I'm waiting sometimes for the sponsor or the CRO.
Mm-hmm. Huge difference. Mitch, did you ever run into that? Ever run into a timeline situation between departments?
Yeah, I mean, you're always up against some timeline, and if you're not, then it's going to move. So you are going to be up against a timeline. That's how the industry tends to work. But when it really comes to like the communication almost disconnect, where it's like Viljena and Alan are literally on the same side of the table, but then they're both also then waiting on the opposite parties. A lot of that communication aspect is like, I really wish we just had couples counseling for how we can better communicate between sites and sponsors, right? That's what we should do a conference for next time, guys.
Yeah,
Honestly, everything boils down to communications.
So I have an interesting situation for you, and this has happened so many times. But you're in the middle of a negotiation, Alan, and you're doing everything right. You're being friends, all this, and so then all of a sudden it's just the CRO tells you something. Oh, well, the sponsor decided they're going to do an amendment. They're going to wait on this, or put this on hold. We're going to revisit this when they're done changing something, right? And then you wait and you wait and you wait, and miraculously, the clin ops people put you on an email list, so you know what's going on with the study team. So as you're waiting and waiting and waiting, you see the progress of the trial, the newsletters, congratulations on this enrollment, that enrollment. So then you go back to the negotiator and say, hey, the trial's up and running. What's going on here? Oh, no, we're still waiting on a budget amendment. We're still waiting on an amendment. So you catch the CRO negotiator in the middle of a lie to stall your site, while you, at the same time, you are witnessing the trial perform.
Right.
So my question is, have either of you ever seen an experience like that?
Nothing exactly like that. I have seen situations where we, get all the regulatory stuff together really quick, and the initial communication with the contract and budget people is positive, and then they go silent on the contract side, but we're still working. And after a month, if I don't get a response, and I have the coordinators putting work into it, I just send an email and say, we're going to stop all work as of today until we can do get a contract together. We've already done A, B, C, and D. And at this point, I have multiple other trials that we have to prioritize. 95% of the time, they get right back to us, and they're like, "Oh, we're very sorry for the delay." And there's multiple excuses, and I'm sure there are valid excuses. These are big companies, and a lot of stuff falls through the cracks. But that is how I will handle it. I won't get upset. I'll just be like, "Okay, not a problem. We're going to just push your trial to the side, and we're going to focus on this other stuff until we can accomplish a budget and a contract."
What about you, Viljena? Have you ever caught the site in the middle of something, or have you ever seen like your organization get caught in something like that?
Well, my current organization, not yet. Hopefully never.
Hope not.
But I know they won't because they're very, very conservative. But the main thing, and it's like this joke too on our side, the operations and everything is, and there's been memes made about it on Facebook and everything that first version of the protocol, it's never the best, and just wait a few weeks, maybe a couple months, and something slips through the cracks, something needs to be adjusted. They do the first protocol submission to the IRB, and they're like, oh, we missed this and this. There's always a guarantee that there's going to be amendment. The amendment changes scope, and then because there's like layers of people who are involved in the process, both on sponsor side, CRO side, by the time it gets to site barely hears anything, and they don't know what to do. And I feel bad that the communication is so broken. And also, the other thing I've noticed is that they need time to figure out what we're going to do, how we're going to proceed with this. Because if scope changes, funding needs to change.
Yep.
There's a lot of variables, so it takes them some time. And with teams working in silos, that's a problem too. Nobody knows what the other team is doing. That's why, just like I love having sites as friends, whichever organization, department I'm working within, I always try to make as many friends as I can so I can understand all the cross-functional stuff. And that makes me a better negotiator, and that makes me a better contract manager who can, see the big picture and help both the CROs and the sites as well from my current role to get it wrapped up and let's get this trial to patients. But as far as negligently holding the site in silence and not communicating, it's usually, somebody goes on maternity leave or somebody leaves a company and something just slips through the cracks, those types of errors. So it's very important to, like one of my pet peeves is when people don't have a phone number in their email signature. I'm like, I can't call you. I don't even know if you're alive. So communicating with site sponsors, CROs, whatever, super important, just to make sure that we are all still on the same page and we keep the momentum going. Yeah. So
well, I've heard, and I don't know, Alan, you might be able to confirm this, maybe Mitch, but there are practices where sites are activated or at least awarded in a far greater amount than the sites that are intended to be activated. In other words, we're going to throw out 100 awards and we only intend to activate 75 of them. It's kind of like farming. Like you throw out all these seeds and you see what grows because you cannot afford.
Right.
I know it's a thing. Nobody has to confirm it, but I know it's a thing. But anyway, I like what Alan said. So I've always used a clinical research site as a restaurant and an analogy where you only have so many tables to serve people. And, let's face it, if you have a line of people waiting out back to get in your restaurant, you can't let someone sit there and drink water and eat free chips. It's like order something or get out. And so I'm sorry, but if you are not confident that you want to work with my site, like Alan said, no harm done, but I'm going to have to kick you out of this table because we got to give it to someone else.
Right.
And Alan, my guess is you probably don't do many competitive enrolling trials, right? Because
we try not to.
Yeah. So if you're not doing a competitive enrollment trial and someone's sitting there taking your slot for this certain indication, they are keeping patients from getting treated with other trials that would love to be sitting at that table.
Many times I'll sit in meetings and people with the docs and the coordinators will bring up, what should we do? They're delaying us. I'm like, we're going to move on. That's what we're going to do. But the train's always going down the track. So we can deal with that. If they want to deal with it, they'll contact us. Otherwise, we have dozens of other trials that we need to focus on.
We've got a question.
And I mean,
Go ahead, Viljena.
Well, and I was going to add, Alan, to that is from the CRO sponsor perspective, like if something's not working without you with your site and we're like really, really struggling with getting sites onboarded, we'll call you back and ask you, hey, would you reconsider?
So it's the same thing. So nobody has to be desperate. Nobody has to be desperate. You have to make sure that there's a mutual benefit between the site and the sponsor. And that's the thing. Nobody's strong arming. Nobody's saying, nobody's being a bully. It is literally a mutual agreement, which that's what it says in the CTA. But I think people may want to Google what mutual means, because oftentimes that gets tricky. I love Kelvin's question. Shout out to Kelvin. Kelvin is like my number one fan. I'm Kelvin's number one fan. And I'm so glad he asked that. So why does it take 8+ weeks on average for contracts and budgets to be finalized? What are the potential solutions? Oh man, Kelvin, you're talking to the choir here. Let's start. Whoever wants to come in first, whoever wants to take that. Why is it taking so long to do this? Go ahead, Viljena.
I'm going to tell you 8 weeks is actually fantastic.
Mm-hmm. Yeah.
Depending on the indication and type of the site, 8 weeks is actually really, really good. And I would say just knowing, like, if there was a match between Alan and I, we would get it knocked out in 2 days, probably.
Challenge accepted.
Resourcing is something that I mentioned. Resourcing is something that I mentioned is CROs have set amount of days that they can hold on to a contract before they move it to the next step.
Mm-hmm.
So,
yep.
Yeah.
And they get paid for that entire time, don't they?
It depends on the contracting structure.
Yeah. So, Alan, I think we talked about this during the podcast, but I see a 3-to-1 ratio. If there's a contract on my desk for 1 day and I send it back, it takes 3 days for me to get it back.
Yeah, that's probably most likely the case. Also, my experience is that, again, I still try to get that out within 48 hours. There are some that I can't, but at least the initial, here's what I'm thinking. Here's what I feel we would need to run this trial. And if there's any weird contractual language, just sort of address that, and then put it in their court. So the 8-week question from Calvin, I've seen that more on obviously the university side, where it could be 26 weeks. But even in on the outpatient sort of site side, I know that our group is probably on obviously the faster side. A lot of that, frankly, is driven by me. I'm really interested in the budgets and contracts. So if you're really interested in something, right, you really want to focus on it, right? And so that's what I do. But I have heard from, my contacts within CROs and sponsors that, wow, this is great that you're able to do this, because it's usually a struggle to get these things executed.
Yeah.
And I'm like, thanks. That's one good thing in our column.
That's why we love Alan. So Kelvin, this is my experience. And if you go through an average negotiation, this is what happens. You get awarded a trial, you're given the CTA and the budget, and then they ask you right there for a timeline, what's going on. I try to knock it out like Alan. I try to knock it out within 48 hours. I make it a priority. I send it to them. Boom. It's done. Here's all my counters, everything. Thanks so much. I'll take a look at it. About 3 days later, I'll get it back. So now we're in first counter, right? You go from first offer to first counter. And then they send it back to me. I take a look at it. Okay, I don't like this. This is great. I'll accept this. Okay, send it back. Boom. Now you're off to second counter. Takes them another 3 days. And then they send it back to me. Now you're in third counter. On average, you're going to get third counter as your approved budget, one way or the other. You've seen both sides, you've compared notes, and you figure out what everyone wants. So if by the time you get to third counter, Kelvin, odds are you're probably at 6 weeks maybe between the back and forth doing things. And if you don't get third counter to be approved, then it turns into the giant E word. Well, if we can't get this approved, I need to escalate this to the sponsor.
Yeah.
Oh boy, here we go. So send the escalation with a recommendation to the sponsor, and then you wait and you wait. And then from a site's perspective, what happens is 2-3 weeks later, have you heard anything from the sponsor? Right. Oh no, still waiting on the sponsor. Oh yeah, I got that a week ago. It's just sitting on my desk. When you pick whatever you want. But then, okay, go back and forth. And you could go up to a third counter with the sponsor if nobody is really liking what's going on. So then by the time you hit that, you're probably at like 12 weeks.
Yeah, I'd add in there too from like the ClinOps sponsor side, right? Seen plenty of those contracts or those issues really come up where it's like, it's what they're asking for, and it's totally bonkers. Kind of something I brought up earlier is the $20,000 opening door fee that Viljena joked about on the podcast previously. Then you'll run into things with undisclosed changes, which create issues. I know that's something that Viljena specifically mentioned. She goes back and checks for as well. So, not saying it's specifically like a site bottleneck issue either, but that whole concept we've been talking about of negotiating in good faith and not just trying to strong arm something or sneak something in here to try to sneak it by. Anytime that stuff happens, it means you can just kind of anticipate more delays, right?
Yeah, I think the undisclosed changes, that does happen. So, you have to be very careful. Another thing that adds into the delay process is the time of year. If it's close to the holidays or it's over summer, people take off, right? People take off, and those
And Kelvin, just so you know, remember that explanation that I did, that's assuming that Alan being on the site is the decision maker. If you ever have to do something where Alan has to vet it through some chair of a department or to the PI for some financial decisions or to your ancillary radiology people to try to get costs to make sure they're okay, anything that Alan has to do to route that into the site itself, now you have a double-sided delay, one on the sponsor CRO side and then one on the site side. So it's actually exacerbated.
Oh, yeah. The other thing that I wanted to add is having good, really good, accurate budget templates. It's so critical, and it has to be a document that's easy to work with, that it's transparent. It shows you everything that's required. The protocol should have a dollar sign. So when I used to train budget analysts to create those budgets, I'm like, everything that you see has to have a dollar sign. Make sure you go not just through scheduled events, but also read the protocol, what's in it. See it from patient's perspective, depending on, therapeutic area. And everything has to have a dollar sign. Whether it happens to everybody or it's conditional, make sure it's there. And the way I see budgets are being created, in the recent years, it's like not everything's captured because, again, CRO has very quick timelines they need to adhere to as part of their contract between them and the sponsor. Like, yes, we have to get this done in 5 days, and he has to go through, the first review, second review, project manager has to review it, then it gets sent to sponsor, and then, okay, how well the project managers on CRO side and sponsor side, how well do they actually understand site budgets?
Or the protocol. Right.
Yeah. Site manager does not have to know how every functional area operates, nor they need to know the budget, but the responsibility is put on them to be that decision maker, and they just look, overall looks fine, sign off. But
it's a rubber stamp.
That's how you see mistakes. Some CROs, pharmaceutical companies, are better than others, and they have processes and everything. But and I think I've mentioned this before in my previous conversations, the costs that we receive from our lovely benchmarking systems.
Fake market value.
They're not where they're supposed to be.
No.
And that's why the big E word comes up so much more often than it used to be 10 years ago when I started negotiating. We could just go back and forth. Hardly anything required escalation because we had really good negotiation parameters. We were able to meet site needs and everything, and everything was fine and dandy. And now it's the trials get more complex, things get missed out. Site is really reviewing with a therapeutic eye whether everything is there that needs to be there. Medicare coverage analyses are done, and the negotiator is it's just my first year negotiating. I have no idea if the site is right. I'm just gonna cross out what is not supposed to be there, and creating more work, more rework, and everything. But correct budgets and good negotiation parameters that are based on fair market value that is actually accurate and is not from 10 years ago. That's one of my pet peeves. So
what about you, Alan?
That one of the tips so if there are 2 line items, and so for instance, let's say startup, I'll throw some numbers out. Let's say I'll ask for $12,000, and say pharmacy startup fee, I'll get $3,000, and they say can't do $12,000 for startup. So I'll say then, okay, can you add that amount of money in any of the other line items? Because they know their parameters.
You
And that's
cost
an
shift it.
easy way to
Yep.
be like, all right,
Very
cool.
easy.
We can't get it
Yeah.
here, but we can get it here. All right, let's agree to that and move on. So you have to sort of, again, play with those line items and see
You have to know how to play with numbers. Exactly.
Yeah.
I used to do that a lot
Yep.
too.
I've done that too. I said, you know what? You've got the magic crystal ball. You see the numbers.
Right.
I don't. So I'm telling you what I need. Feel free to shift it however you want, as long as
And
we can
that's
get
where
there.
the good relationship comes in, because I can say to people, okay, so what can you give me then if you can't give me that?
Mhm.
And I've been pleasantly surprised
Oh yeah.
with some line items that I'm like, oh, that's even much higher than I thought.
Mhm.
So
Yeah.
again, if you have that relationship with someone, they're going to be more open to say, oh yeah, well, I actually can give you this, and
Yeah.
it works. So it's a back and forth. You have to
It's a numbers
trust the
game.
other person, and you can
Yeah.
knock
Well,
out
it's a
a lot of,
negotiation.
Well-
That's why we're doing it.
yeah.
Yeah. Also, the point is for sponsors to get assigned to the awarded study stage. There are so many steps. The site qualification visits. So many people are involved. The amount of money that's already invested
Mm-hmm.
versus let's just drop the site because they're $1,000 over on their startup fee. Like, you already invested so much money.
Right.
How can we make it work? Because we're gonna have to go back to square zero and start looking for new sites through feasibility. And what if it's a difficult indication to recruit or something like that? Let's figure out how to make it work. Let's move some numbers around. So yeah, I've played that game plenty of times to make everybody happy. I mean, all you have to do is just pick up the phone and have those relationships with friends and understand how things work.
You've got a true sunken cost paradigm. That's textbook sunken cost paradigm.
Totally, yeah.
So see, all you have to do, Alan, is just look at the CRO and say, yeah, I'm worth it.
You know what? Actually, part of a good portion of my job is I'm acting like an agent, right? I'm representing the physicians in a private practice. I'm representing the university.
Mhm.
So you have to know your capabilities and what we can and cannot do. The patient population, how many patients we realistically could enroll. And so on a lot of levels, you are acting as their agent and you're representing them. So if you're asking for maybe higher fees than other sites, you better have some good reasons why you're asking for that.
Mhm.
And I think that I wanted to mention one thing. When I jumped into this role, there may have been contracts that have been negotiated well before I got here, right?
Yep.
And so let's say something was negotiated 3 years ago. I'm now going back to the same sponsor and I'm negotiating things. And they'll say, oh, well, you accepted X amount 3 years ago. You have two paths at that point. You could try to adjust it. You can try to go back and forth. You could, say the cost of living, or you simply could say, you know what, we made a mistake on that. We poorly negotiated that. We've actually found that there's much more time and effort. And so we can't make that same mistake again.
Yep.
And so now we're asking for X because we didn't ask for it then. And a lot of times people can respect that. It's like, okay, that makes sense. I'm not giving you a bunch of BS as to why we need more now. Simply, it was not negotiated properly a few years ago. And I've actually used that and people are like, okay, yeah, that makes sense.
I've done it too. And there's a legal way that you could do that too. Every single contract says that you agree that you are not instating a partnership with each other.
Right.
It's not a solicitation for a partnership. Therefore, since it's not a solicitation, so that kind of opens up another thing, and this is negotiations. It's a little bit of a tangent, but my question is, Alan, how do you address trial extensions and renegotiations? How do you open up that?
I have one of those extensions sitting on my desk. And the trial's been going on forever. It's related to RSV. Well, the first thing is the original contract was negotiated before I was on board. And I'm looking at these numbers. I'm like, oh my gosh, this is...
Yeah. What were they thinking?
Right. So I try to, the patient population, this is a vaccine too. So there's a lot of patients as well.
Oh, no.
So like even a simple phone call. So here's a perfect example. 2 things from the extension. One is I never accept holdback, but on this particular trial, this sponsor for what they was like, At first they said 10%. I said, we don't accept anything. Then they said 5. I said, we're not going to do that. Then they said 1%. And I'm like,
Yep.
I'm like, that's like $3,500 based on what we're
Mhm.
probably going to get. I was like, I picked that up in another line item. I'm like, sure, we can agree to 1%. I'm like, why are you doing this?
You know what I do? That's my favorite strategy, and I've gotten them down to 0.25% withholding
Really?
because I
I
think
was like, I don't even want to talk
they
about this.
have to put something in
They
there.
have to put something.
And I
so
said, I'll tell you what, I will give you 0.25% withholding for an additional 3% overhead.
And some of the things we've done, for instance,
Yeah.
this is an older population, and there's a lot of like phone call follow-ups. And
Mhm.
so in these budgets, this is one of my pet peeves. They'll look at that phone call as if you pick up the phone, they answer the phone, you get your information, and you're done. It never works like that. You call, no one answers, you leave a message. Okay. You go back a few days later, you call again, no answer. Or they call you back and you're busy doing something else. Then you try calling in the evening instead of in the, in the morning or whatever. And so and you're keeping track of who you called, who you didn't call, how many times you called. All of that needs captured in the simple phone call. So in this extension, there's these phone calls, and they're older people. And for whatever reason, obviously they need more hand holding in these trials. And that's fine. I get it. But we have to. So I had to sort of discuss that and say, like, here's why we need these fees. One was it was X years ago. These patients are much older now. A lot of other things can happen to these patients now. And so I look at extensions, they're always a good thing to me, right? Because if you had something negatively, you could now make it right.
Mhm.
And if you already have something good, you just continue it on, right?
Mhm.
So extensions to trials, and a lot of patients, depending on the indication and the drug, if they drop out of if the trial ends, they don't have access to that drug. So patients generally like that as well.
Mhm. So what about you,
I'm pro
Viljena?
extension as long as there are certain things, tricky things that if you negotiated years ago, or simple things like a phone call, you need to double down and sort of give a really good justification as to why now the increased fee.
I just want to add there too is I love that point, and I think Viljena kind of commented on that actually during the podcast initially as well too. Was you touched on more or less that patient journey and that site aspect of it's not just a simple phone call. That's how protocols are written. That's how they're designed. There's this glorification of this concept of everything we hope is just going to go perfectly smooth the way we wrote it down. I mean, no issues, right? No protocol deviations.
And the other thing is when you call these patients as part of research, and I, as a coordinator, way back at Children's Hospital, I was calling families whose children had died. This was a bereavement trial. And these people, they wanted to talk about everything related to their child, everything related to what happened in the hospital. And then, oh yes, also the research aspect of it. So it took much longer. So same thing with older people. If you ask them how they're feeling, they want to, and that's fine, right? They want to talk to you about how they're feeling, what prescriptions they're on. Hey, they'll ask you, questions, medical questions, which you have to say, I really can't answer that. So these, sometimes, how many people are calling these people? Not many. So that
They're lonely.
It extends each one of those phone calls just for the fact that you have a relationship with them. They've been in this trial a long period of time, and so all of that, over 50 patients, that adds up. That's a lot of time you're taking away to get these completed.
So Viljena, what do you think about holdbacks and the process of extensions and negotiations?
Holdbacks were implemented way back when we didn't have the systems in place to check visits and make sure that all the data was completed, like until the CRA actually went and source data, verified everything. And holdbacks are so not necessary. Clearly, somebody who thinks it's a great idea has never looked at the spreadsheet that somebody's trying to reconcile to ensure that we have captured every holdback. We have paid the site for every holdback, even that 0.25%. I don't want it. I don't want to deal with it. It is such an administrative burden on like the site payment side. The people who work on that, they hate it. And I, when I was working at the CRO, I was so happy when we finally were able to implement that we are removing it from all the templates. And then the next battle was, I wouldn't say battle, but a very strong suggestion was educating sponsors who are running their first study or who are not as experienced, or the study teams who are not very experienced about it, like, this is why we should not do it. And again, this comes back to being experienced in the industry and understanding what the purpose of holdbacks is and why it's not necessary anymore, explaining to all the stakeholders why we don't need it. If somebody's like very adamant about it, like, clearly we don't need it. In today's day and age, we don't need it. So I'm very happy that the studies that I'm supporting now, we don't have it. It's just one less headache that we can live without, for sure. As far as extension studies, I don't think I have any good examples, but Dr. Fox, when we first met a few years ago,
yep,
I was like, nobody even works here anymore who used to support that study. But I'm going to try to find somebody who can help you. I mean, it was really looking for a needle in the haystack in, 20,000 people organization, like trying to figure out, okay, where can we fix this? And from the perspective of, what's the word I'm looking for? The inflation, the cost of living, and, how all the follow-ups that do take more time. And to Alan's point, I have worked with the elderly very early on in my career, and they need time to explain things, and sometimes they're lonely and they might want to start talking to the nurse because they want that friendly conversation. So what we get from the grant plan grants manager, it's just numbers. They don't reflect the entire picture. So that's why when I would used to build budgets, does this make sense? Does this actually make sense? Do we need to increase the effort? Because one of the things I wrote down here that we were talking about is that was part of my philosophy when I was building the budgets and training people on how to build the budgets. It's, we need to make sure that we capture the effort. We need to capture all the, stay accountable for all the effort that's there. And make sure that no sneaky errors slip through the cracks, because that's going to affect payments. And then payments people are going to hate site contracts people. Payments people are going to hate the sites because sites cannot send the right invoice. But, at the very beginning, what was the root cause of that problem? There was an error in the budget, or there was an error in the contract. I remember back in the day, when I was processing invoices, sites kept sending invoices with the wrong project number. And I was just like, this project does not exist. I can't pay this shred. I mean, obviously we didn't shred it, but I figured out it was an error in the contract. So whenever, when I moved to a site contract negotiator role, when I was finalizing this, I was like making sure, like, I don't want site payments people haunting me. What's wrong with this contract? I love people, but I don't want to talk to them if I don't have to talk to them.
Yeah, and that actually happened to me. There was a contract we had at 4 sites. And I kept sending these invoices and nothing would.
Yeah.
And so the email where they said to send it was no longer active. And that's after like months of me trying to find someone. I was like, you got to be kidding me.
Oh,
it happened.
Fox, I think I know what you're thinking.
Well, so here's the number, and here's a big pet peeve. We're talking about pet peeves. Phone numbers on email signatures, things in the contract. Alan, honestly, where do you have to get your site numbers from? Where do you get, like, hey, what's the site number for this trial? Where do you have to get that from?
Oh, that's painful sometimes. But the site number is never on the contract.
It's
I
never.
I don't understand.
I have to get it from my regulatory people almost 100% of the time. So there's no the site administrators do not have access to the site number ever. It's nowhere in the contract negotiation.
Yeah, that is a huge 100% of the time. It's never on the contract budget. And so sometimes I'm literally searching through emails. I was like, oh, there it is in the email. I see site number.
It's in the email chain, the name of the email. Oh yeah, that's the. But you always have to, like, your regulatory team knows your site number before you do most of the time.
I'm trying to build it into the CTMS. I'm like, oh my gosh, what is this site number? I'm looking around for it. It's a problem.
And what's the number one way that we get paid?
Yeah, it's based on
site number.
Well, I'll tell you the reason for it, why it's not in the contract. Because as a negotiator, you get a list of 10, 15, 20, 30, 40 sites. And you just attach and send, attach, send,
Mhm.
attach. You don't have time to go in there and modify every one of them and to type in a number. I didn't have time for that. I wanted the sites to do all the work. One of my pet peeves as we were negotiating was the site would send me like, oh, here's an information. Just put in a contract for us.
Yeah, I
No!
tried to do that. I tried to put that in the contract to save them the hassle, because I know they have dozens.
Yeah, I
of
mean,
contracts.
I do what I can
Or,
to make their life easy.
numbers, like instead of like using a spreadsheet to put in the numbers that you want, oh, please put this in our budget. And I'm like,
Mhm.
that was my pet peeve.
So we're actually the hour went fast, and I did want to focus on one more topic before we end. And this is the big similarity that I found in both of your interviews from the podcast. You both said resoundingly that the number one priority when we negotiate is the patient. You both hit that really, really hard. And I was wondering if you'd be willing to tell me one of your victories from that story. Like, do you have a cool negotiation victory story where you busted your butt, you 24/7 got this thing done so that you literally saved a patient's life?
I mean, I worked with patients for many, many years, and I can give you a story somewhat related to research, because it was a heart-lung bypass machine. So this was a newborn baby who was in intensive care, was on ECMO therapy. And back then they had the tubing that they used, to pump the blood through the artificial machine. It wore out over time. And this particular instance, this child, the tubing burst, and the child ended up dying. So I learned two things from that. It was one of my very first patients I ever worked with. I learned two things from that. Years later, I learned that they did much more research and development, and they found better polymers to make this tubing. And so that never happened again to any other family. So, and that's only through research. And so there was that. The other thing I learned with patients is I was up many nights with this family discussing the prognosis, the scientific things that went on, all the technology. I was very patient with them. They sent me a letter after their child died. They wanted to thank me for just being compassionate and listening to them. That was what was most important to them. Not all the technical jargon I went through with them, not all the blood gas results and lab results. They really appreciated that connection, where that compassion. And so I've learned that, like, through clinical trials, like, there's many people at the end of all of these trials, just like that baby and that family, that we can help. That we're, as administrators, it's tough sometimes to know the end result of how these patients in these trials can, how they're doing down the road. That would be something that I'd be, more interested in exploring, having patients come back to tell their story. But from those experiences, I've certainly learned that, like, this is about the patient. That's what this is about. The rest of this stuff, it's all reindeer games, right? It's like, okay, we're shuffling papers, we're negotiating things. At the end of the day, everybody gets to go home. And so we need to make sure that we're doing right by the patient.
What about you, Viljena?
Well, Alan mentioned the end result. Being in steady startup for so many years, you hardly ever see the end result, because you just churn and burn, and you get the next study, and it's the startup, and you don't see the end of it. I did have an opportunity to work on COVID vaccine study, and 3 years later they're like, yes, we got approval, but then can't really get it to market for whatever reasons, because WHO did not approve of how the drug was created, because it was related to tobacco. But the thing that really drives me, and this is my philosophy and what makes me wake up every day, is, especially because it's oncology where I live and breathe now, is there's patients, we need to get these trials to them as fast as we can. There was one study that I worked on last year great treatment, very promising and everything. And we were just having really hard time getting sites up and running. And finally, there's a site that says, we found a patient. We found a patient, and we're just like, chug, every day meetings with a CRO, with a study manager, going back and forth, making concessions for all the site's requests. And we're sitting here on the Friday, it's like 4:30, end of the day, and nothing happens on Fridays. Somehow magically we were able to route everything through DocuSign for signature, so subject would screen that Monday. That was amazing. That was a large academic institution. We made it happen. It was like me and the study manager were cheering and just very, very happy. And she even shared that, I'm running around the house and my kids are like, Mommy, what's wrong with you? So, very, very happy moment for us. But then you had the low that because it took us so long to get the study up and running, by the time the patient screened, they had metastases. So they couldn't qualify for the trial, unfortunately. Personally, and this is, I think, is something that most people who work in clinical research somehow, either themselves or family member, somebody ends up enrolling in a clinical trial, just for the heck of it. Just, oh, what is it like? My son is actually, he has multiple food allergies, and a few years ago, we're like bouncing from one allergist to another allergist, and they're like, "There's no cure." I'm like, well, I know there's no cure. What options do we have? And he was too young for any like oral immunotherapy and whatever. So I found a new allergist, and we waited for a clinical trial to open. And because of my persistence, he was one of the first 20 patients who got through like the placebo phase, who got through that. And then because he was one of the first 20, and I'm going to say something about the study design that I'm probably not supposed to say, that's confidential, but I think it's public right now, but he got into the long-term extension study where he was actually getting the therapy. It was amazing. It was, watching your child eat a regular birthday cake that has dairy and eggs and everything, it was like the best birthday gift I could ever had a couple of years ago. It was amazing. And because I'm so savvy about the clinical research industry, I found out through media that the trial was actually successful and FDA recommended approving this drug for this new indication. And I've been watching interviews, truly geeking out about everything. And I think a few weeks later, I wish I could pull up the email, but our study coordinator emailed us and thanked us for participation. And she wanted to reiterate to our children, what true heroes they are, that they have helped by their participation, have access to treatment for these multiple food allergies to so many more people because of all the hard work and effort and everything they've gone through. And it was a very difficult trial. So that's my patient perspective, one of them that I always keep in my mind when I'm doing, pushing papers.
I think so. That's a perfect, tangible way that we help patients. Yeah. Like people, you don't realize all the behind the scenes work that goes into these trials. And the end result is, in many cases, we are helping patients.
Yeah. We just don't see it. Right. The other thing I wanted to kind of share that is very cool about what my current employer does, every Monday of every month, we have a patient actually come and talk about their experience, whether they have been on our drug or not, but they participate in like patient advocacy organizations, and there's an interview, they tell a story, and you actually see the people. They're right there in front of you, maybe on the computer screen, but they're real people that we do all this work for. And that's been a really great experience.
Reminding us why we're here and why we're doing it. I think it's really important. I love that feeling of where you're sitting there watching TV and you see a drug commercial on there and you're like, I worked on that. Oh my gosh, that's so cool. That one. I remember all the different trial aspects of that.
We worked with Mounjaro or tirzepatide forever. Oh, now it's everywhere. I was like, yeah,
it's everywhere.
That.
Nice.
You're sitting there like, oh yeah, I remember those side effects. No, we don't know that.
Well, that's the name they went with.
Yeah, pretty much. So we're at the top of the hour. We're gonna wrap up. I did want to see. So Kelvin asked something that it touches my heart. So Kelvin says 6 weeks it still feels like a long time. I feel like there's a better way to streamline communications or use an efficient fintech model. Kelvin, we got to talk. You're talking my language there, man. So the CRPN has the initial data out. We have sponsors and site partners in the network. We are saving 98% time in startup and 70% in costs with the sponsors and the sites who are a part of the network. That's my CRPN plug. Let's wrap this up. So Viljena, Alan, Mitch, everyone, if you had to tell everyone something about negotiations, about what we talked about today, and about how you'd like to, like the last notes, last memories that you want to give them, what would you tell them? Let's start with Mitch. Mitch, you've been quiet.
Yeah, I mean, you have two phenomenal individuals like Alan and Viljena on. I got to be quiet. I think my biggest takeaways from these conversations and listening to everyone talk and the previous podcast as well is really just to encourage that continuing education of a different perspective, right? You know your own perspective anytime you're negotiating something or talking about something. Hopefully you are very well aware of your own perspective. But try to look at it from someone else's shoes. And I think what a lot of sites and sponsors CROs are going to find is that process of getting that contract done and getting those negotiations quicker is going to go a lot swifter if you're trying to look at it from someone else's perspective in addition to your own.
Mm-hmm. So what about you, Alan?
The thing that comes to mind is my personality is more gray. It's never black and white. And so it helps me with negotiating, right? Because there's never one way to ever do this. And so if you have an open mind and you are sort of in that gray area and you find creative ways to sort of get the money you need to conduct the trial, every single person you're dealing with is probably a little different. And as long as you're flexible and creative, also you have to be very descriptive and articulate. Those would probably be the key things to successful negotiation.
Viljena?
Yeah, I have to concur with Alan. Creativity is, you have to think outside the box. You cannot just stay in the little box and
Right.
be there. The one thing that I wish our CRO partners could do better is use proactive management instead of reactive management. And that reactive management, it escalates to the sponsor level as well. We are open to hearing solutions, suggestions. We have this issue that we cannot come to agreement on with a site. Like, okay, what experience do you have with the site or similar sites? Have you been in this situation? Have you had this cost before? That $20,000 open the door fee for us to even look at your contract. And that's not even the highest that I've seen, but like, share your experience, be a partner with us, give us your historical metrics or costs, or just some creative ways of solving these off the wall issues. The other thing is, I've been very fortunate with my former employer, with my current employer, to attend industry conferences and participate in workshops and everything, and actually meet sites face to face. Because day after day, we're just like in front of a computer screen, and we never see the people. Especially now that most of us are working remotely, we can't have those conversations. So I've been very fortunate to go to different conferences, actually meet the people that I've negotiated with, talked with. The after hours events like we had at SOS and everything, you get to see so many people, you get to brainstorm with them, you get to talk to them without filters, and you get different perspectives. So, go to conferences if you can, share the lessons learned with your coworkers, the rest of the team, see how we can bend the processes to make them more efficient. And then, the creativity. You have to be creative. This is not just like cut and dry. This is the legal language, and this is fair market value that sponsors are willing to pay. No, it's never like that.
Right.
But
Yeah.
we have to be reasonable.
Well, and that's a whole other podcast. But Viljena, you said the word churn and burn, right? So you just keep churning and burning through these studies, and you base it off of signed contracts, but you never validate the costs after the trial is performed. you never
Mm.
really assure that it is the actual fair market value, because all you're doing is basing it off of a bunch of guesses. There is no validation. So,
Yeah, no, it's
it's
numbers that maybe
all just
eventually
made up
do get
numbers.
into the fair market value system. I don't know.
Yeah. Well, we should have a follow-up podcast on that. But importantly, I want to respect everyone's time. We are just over an hour. The hour went by fast, and honestly, I had a ton of fun. I learned all kinds of things. I laughed, I cried. Now I want some tacos. But importantly, thank you so much, Viljena, Alan, Mitch. Thanks for coming on to CRPN Central Live today.
You're
I
very
hope that
welcome.
our audience had a great time watching it. Please like, comment, subscribe. I'd love to see more than 34 subscribers on the YouTube channel now. It really does help with the mission. And importantly, I'll see you all next time.
All right. Have a good day.
Bye, everyone.
Thanks so much. Have a good one.